These blood pressure numbers, specifically the new 130/80 target, could save your life after 65, and the guidelines have changed dramatically in ways that might surprise you. As the American Heart Association's latest 2025 guidelines show, for decades doctors treated older adults differently when it came to blood pressure, assuming that higher numbers were fine as we age. But groundbreaking research over the past few years has flipped that thinking completely, revealing what your blood pressure should actually be. Right now, more than 70% of Americans over 65 have high blood pressure. That's nearly 3 out of every 4 seniors walking around with numbers that could be silently damaging their hearts, brains, and kidneys. But what's really shocking is that only about 1 in 5 people with high blood pressure actually have it under proper control. We're talking about a massive health crisis hiding in plain sight. Let me start with what blood pressure actually means, because understanding this will help you make better decisions about your health. Think of your circulatory system as a network of pipes carrying water throughout your house. Blood pressure is the force of that water pushing against the pipe walls. The top number, systolic pressure, measures the force when your heart contracts and pumps blood out. The bottom number, diastolic pressure, measures the pressure when your heart relaxes between beats. As we age, our blood vessels naturally become stiffer and narrower due to atherosclerosis, like old garden hoses that have lost their flexibility. This arterial stiffness means our hearts have to work harder to push blood through these increasingly rigid pathways. The result? Blood pressure tends to climb with age, and the risk for cardiovascular problems doubles with each decade of life and each 20-point increase in systolic pressure. Now, let's talk about the dramatic changes in guidelines that have left many seniors confused about their target numbers. Back in 2003, the medical standard was simple. Keep your blood pressure below 140/90, regardless of age. Then in 2014, doctors relaxed those targets for people over 65, saying 150/90 was acceptable. Many seniors felt relieved, thinking they had more breathing room. But then came 2017, and everything changed. The American Heart Association and American College of Cardiology dropped a bombshell, lowering the definition of high blood pressure to 130/80 for all adults, regardless of age. Suddenly, millions of Americans who thought they were fine discovered they now had high blood pressure. The medical community was split, and seniors were understandably confused. The controversy deepened when researchers realized that treating blood pressure in older adults isn't as straightforward as younger people. This sparked what doctors call the "how low should you go" debate, and it's still raging today. On one side, you have compelling evidence that lower is better. On the other side, you have growing concerns about pushing blood pressure too low in certain elderly patients. Let me tell you about the SPRINT trial, which changed everything. This massive study involved over 9,300 adults with high blood pressure, many of them seniors. Researchers compared 2 groups, one aiming for blood pressure below 140 and another pushing for below 120 using intensive treatment with thiazide diuretics, ACE inhibitors, and calcium channel blockers. The results were so dramatic that they stopped the study early after just 3 years instead of the planned 5. The intensive treatment group, those targeting below 120, had 25% fewer heart attacks, strokes, and cardiovascular deaths. They experienced 38% less heart failure and 27% fewer deaths from any cause. These weren't small improvements. These were life-changing differences. Dr. Jackson Wright, one of the lead investigators, called the results spectacular. But here's where it gets complicated, and this is crucial for you to understand. The SPRINT study primarily included relatively healthy older adults who could handle aggressive treatment with beta blockers and other antihypertensive medications. They weren't the frail seniors struggling with multiple health conditions, medication side effects, or mobility issues. This created a gap in our knowledge about what's best for the most vulnerable elderly patients. Enter the concept of frailty, which has become the game changer in how we think about blood pressure in older adults. Frailty isn't just about being old. It's a medical condition characterized by decreased strength, endurance, and reduced function that increases vulnerability to developing increased dependency or death. Research now shows that frail elderly patients may actually be harmed by aggressive blood pressure treatment. A groundbreaking study called PARTAGE followed elderly nursing home residents and made a startling discovery. Among residents taking 2 or more blood pressure medications, those with systolic pressure below 130 had higher death rates. But among those taking no medications or just one, low blood pressure wasn't linked with increased mortality. This suggests that it's not just the blood pressure number that matters, but how we achieve that number. Dr. Brian Williams from University College London, who chairs European hypertension guidelines, puts it perfectly. The elderly population is a classic example where we need not just guidance but actually some clinical decision-making on a patient-by-patient basis, bespoke medicine, with tailored blood pressure targets. This individualized approach is reflected in the latest 2024 European guidelines, which recognize three categories of blood pressure management. For healthy, robust older adults aged 65 to 80, they recommend targeting systolic pressure between 120 and 129. For those over 85 or with significant frailty, they suggest more relaxed targets, focusing on what's reasonably achievable rather than pushing for specific numbers. The connection between blood pressure and brain health adds another layer of urgency to this discussion. High blood pressure doesn't just damage your heart and kidneys, it's also a major risk factor for cognitive decline and dementia. The SprintMind study found that intensive blood pressure control reduced the risk of mild cognitive impairment by 19% and the combined risk of dementia or cognitive impairment by 15%. Even more impressive, the recent CRH-CP3 trial involving nearly 34,000 people in rural China showed that blood pressure reduction lowered the risk of all-cause dementia by 15%. This is particularly significant because it suggests that controlling your blood pressure today could protect your mind years down the road. But there's a dark side to aggressive blood pressure treatment that seniors need to understand. Dr. Jason Guichard from the University of Alabama puts it bluntly, high blood pressure is a problem, but low blood pressure is also a problem. When blood pressure drops too low, especially the bottom number below 60, older adults can experience fatigue, dizziness, and frequent falls. This phenomenon is called the J-curve, where cardiovascular outcomes actually get worse if blood pressure drops too low. Research shows that while lowering systolic pressure to around 130 provides benefits, pushing it below 120 may increase the risk of cardiovascular events and death in some patients. The sweet spot appears to be somewhere between 120 and 130 for most healthy seniors. Orthostatic hypotension is another serious concern, affecting between 5% and 30% of people over 65. This happens when blood pressure drops significantly upon standing, causing dizziness and fall risk. Falls are a leading cause of injury and death in older adults, so avoiding medications or dosages that increase fall risk becomes a critical safety consideration. So what's the real truth about optimal blood pressure for older adults? The answer depends on who you are. If you're a healthy, independent senior between 65 and 80 without significant health problems, targeting a systolic pressure below 130 is generally recommended. The evidence from SPRINT and other studies strongly supports this approach for preventing heart attacks, strokes, and preserving cognitive function. If you're over 80, the recommendations become more conservative. While some healthy 80-year-olds can benefit from intensive treatment, targets around 130 to 150 systolic may be more appropriate for many in this age group. The key is ensuring that treatment doesn't compromise quality of life or increase fall risk. For frail seniors or those with multiple health conditions, the approach should be highly individualized. The focus shifts from achieving specific numbers to maintaining function, preventing falls, and optimizing quality of life. Sometimes this means accepting higher blood pressure numbers if aggressive treatment causes more harm than good. The diastolic pressure, that bottom number, deserves special attention in older adults. While most focus goes to systolic pressure, having a diastolic pressure below 60 can be dangerous for seniors. This isolated diastolic hypotension increases the risk of heart failure and can cause the fatigue and dizziness that leads to falls. Women face unique challenges as they age. Hypertension control tends to decrease more in women than men as they get older, making this disproportionately a women's health issue. Since women live longer than men, they're more likely to experience the frailty and multiple health conditions that complicate blood pressure management. The latest 2025 guidelines from the American Heart Association acknowledge these complexities. They emphasize that determining optimal blood pressure targets for older adults requires considering comorbidities, frailty, quality of life, and individual goals of care. It's not one size fits all anymore. Lifestyle factors remain crucial, regardless of your target numbers. The DASH diet, recommended by the American Heart Association, emphasizes fruits, vegetables, and low-fat dairy, while reducing sodium intake to less than 2,300 milligrams daily. Losing even 5% of body weight if overweight and maintaining appropriate potassium intake can significantly impact blood pressure. The 2024 European guidelines particularly emphasize these lifestyle modifications alongside medication management. Regular monitoring becomes even more critical as you age, especially considering white coat hypertension, where blood pressure readings are elevated in medical settings but normal at home. Blood pressure can fluctuate more in older adults, and the risk of both high and low pressure complications increases. Home monitoring and ambulatory blood pressure monitoring can provide valuable information about your actual blood pressure patterns outside the doctor's office. The medication burden is another consideration. Many seniors take multiple medications, and adding more blood pressure drugs can lead to interactions, side effects, and what doctors call polypharmacy problems. Sometimes the goal becomes finding the minimum effective treatment rather than the maximum possible blood pressure reduction. Here's what this means practically for you or your loved ones. First, have an honest conversation with your doctor about your overall health status, not just your blood pressure numbers. Discuss your functional abilities, other health conditions, current medications, and personal goals for treatment. Second, understand that blood pressure management in seniors often involves trade-offs. The goal isn't necessarily to achieve the lowest possible numbers, but to find the sweet spot that reduces cardiovascular risk while maintaining quality of life and function. Third, be aware of symptoms that might indicate your blood pressure is too low. Persistent fatigue, frequent dizziness, especially when standing, or increased falls. These symptoms are just as important to report as high blood pressure readings. The emerging research on blood pressure and dementia prevention adds another compelling reason to take this seriously. With dementia cases expected to triple by 2050 as the population ages, any intervention that can reduce risk by 15% represents a significant public health opportunity. As we look toward the future, personalized medicine approaches are becoming more sophisticated. Researchers are developing ways to better identify which seniors will benefit from intensive treatment and which might be harmed. Factors like arterial stiffness, kidney function, cognitive status, and frailty scores are being integrated into treatment decisions. The takeaway message is clear. Blood pressure management in seniors has evolved far beyond simple number targets. It's become a personalized approach that considers your entire health picture. The real truth is that optimal blood pressure depends on who you are, how healthy you are overall, and what matters most to you in terms of quality of life. If you're a healthy, active senior, the evidence strongly supports targeting lower blood pressure numbers to protect your heart and brain. If you're dealing with frailty or multiple health conditions, a more conservative approach focusing on safety and function may be wiser. The key is working with healthcare providers who understand these nuances and can help you navigate the complex decisions involved. Your blood pressure numbers after 65 matter more than ever, but how we achieve and maintain those numbers matters just as much. Understanding these principles empowers you to have better conversations with your healthcare team and make informed decisions about your cardiovascular health as you age.